Lung cancer, LC, is the second most prevalent tumor worldwide. Lung cancer also is the most prevalent cancer in males, followed by prostate and colorectal cancer. Lung cancer has a poor prognosis, and more than 75% of lung cancers are diagnosed in a late advanced stage with multiple systemic metastatic, particularly in developing countries. Next, several extrinsic and intrinsic factors play a significant role in lung cancer pathogenesis. Extrinsic factors included lifestyle, environmental toxicants, occupational exposure, and some specific infections, while intrinsic influences involved sex, immune, and genetic factors. The epidemiology of lung cancer. Lung cancer is the second most diagnosed malignancy globally and is considered as a significant cause of death. In 2020, over 2.2 million new lung cancer cases were reported, with an estimated 1.7 million deaths. Next, the incidence patterns of lung cancer vary based on sex, geography, environmental contamination, occupational exposure, and histologic subtypes. Smoking is the most significant risk factor for lung cancer, responsible for over 90% of cases in men. Meanwhile, occupational exposures contribute to 10–20% of lung cancer cases, and there is a synergistic effect between smoking and occupational exposures. Lung cancer is the heterogeneous illness with wide range of clinical and pathological features. Lung cancer is histologically categorized into small cell lung cancer and non-small cell lung cancer. Non-small cell lung cancer is further subdivided into adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. The 2015 WHO classification claims that adenocarcinoma is the most common form of lung cancer, followed by squamous cell carcinoma. The prognosis for all lung cancer types is poor, especially squamous cell carcinoma and small cell lung cancer. Genetic susceptibility plays a role in lung cancer risk, with nearly 85% linked to cigarette smoking and 10–15% occurring in non-smokers. Smoking and environmental toxicant exposures lead to somatic mutations in lung cancer affecting oncogenes and tumor suppressor genes. The Cancer Genome Atlas revealed the genetic complexity of lung cancer, with various mutations identified as following. Next, vaping smoke contains carcinogenic compounds that increase the risk of lung cancer, and waste products contribute to environmental contamination. Exposure to specific environmental toxicants from vaping, air pollution, heavy metals, and asbestos negatively impacts pulmonary function and enhance lung carcinogenesis. Electronic waste from vaping products, including disposable vapes, pods, cartridges, e-liquid containers, can leach contaminants into water, soil, and air. Vape batteries and metal-coated wires in e-cigarettes can leach heavy metals and battery acid and nicotine into the environment, posing risks to human health. Both smokers and individuals exposed to secondhand smoke in contaminated environment are more prone to develop lung cancer. Moving on to vaping and lung cancer. What is vaping? Vaping refers to the use of electronic cigarettes, ECs, or similar devices to inhale heated and aerosolized substances. Vaping devices can deliver nicotine, flavorings, cannabis, CBD, and other chemicals. Originally designed as nicotine replacement therapy to aid smoking cessation. And what is lung cancer? Lung cancer is a type of cancer that originates in the lungs. It is often associated with a history of smoking. There are several risk factors associated, which includes smoking, secondhand smoke, radon gas, asbestos, and air pollution. Next, the compound. First, the nitrosamine compounds. Adequate concentrations in distal bronchioles and alveoli, potentially causing DNA adduct formation and DNA damage. Studies on mice exposed to EC fumes for 3 months showed an increased incidence of lung adenocarcinomas. The inflammatory response induced by ECs may contribute to lung cancer development, creating an immunosuppressive environment. Secondly, the propylene glycol and vegetable glycerin. Heated PG and VG in ECs undergo thermal degradation, producing pulmonary irritants, free radicals, and suspected carcinogenic carbonyl compounds which contain acetaldehyde, formaldehyde, and acrylane. Chronic exposure to PGVG is proposed to damage epithelial barrier function by reducing lung cell volume and membrane fluidity, contributing to airway damage. Then, the flavoring compounds. Flavoring additives in ECs often include aldehydes, and studies have examined the impact of toxic aldehyde emissions during vaping. Formaldehyde, acrylene, and acetaldehyde present in ECs vapors are recognized carcinogens. Flavoring compounds in ECs may contribute to lung cancer through mechanisms like inducing toxic activity, inflammatory responses, vascular injury, dyslipidemia, increased platelet reactivity, and oxidative stress-induced lung tissue damage. Lastly, the cannabidiol, CBD, vaping products. Aerosolized CBD induces apoptosis, pro-inflammatory reactions, enhanced cytotoxicity, and potentially harmful adverse effects on lung cells. Potential cannabis oncogenicity is attributed to toxic and pro-inflammatory effects on respiratory functions, causing pulmonary irritation. Common additives and pollutants in vaping fluid, their mechanisms of pulmonary damage or related toxicities. Next, environmental toxicants and lung cancer. Tobacco smoking is a potent lung carcinogen, and a substantial percentage of lung cancer mortality occurs in non-smokers. Moreover, chronic pulmonary inflammation is a significant risk factor for lung cancer tumorigenesis. In the realm of environmental health, various chemicals are proposed to affect well-being. Exposure to known and probable respiratory carcinogens, including metals and organic toxicants, enhances carcinogenesis. Additionally, certain substances such as heavy metals, radiation, and pesticides can cause changes in cells and molecules that may lead to cancer. Environmental, dietary, and lifestyle factors can significantly influence molecular pathologies and pathogenic processes of lung cancer. Moreover, nutrients and phytochemicals with antioxidant/anti-inflammatory properties play a crucial role. They may not only reduce oxidative stress and DNA damage, but also modulate epigenetics, potentially affecting or preventing lung cancer pathogenesis. In addition, the use of dietary antioxidants and nutritional supplements in cancer patients, including those with lung cancer, has demonstrated promising results. This includes a reduction in cancer growth, mutation rates, and the induction of differentiation/de-differentiation. Furthermore, it's important to note that smoking is intricately linked to specific mutational signatures. This connection increases cancer risk by elevating somatic mutation load, encompassing base substitutions, indels, and copy number changes associated with DNA damage misreplication. Moving on to radiation, radon, medical radiation, and air pollution. Exposure to ionizing radiation is a known cause of cancer, particularly lung cancer. Moreover, all ionizing radiation groups are classified as carcinogenic to humans. The main types of radiation linked to lung cancer include X-rays, gamma rays, and alpha particles. Additionally, medically related procedures contribute to 48% of the average individual's radiation exposure in the US. Notably, recent research indicates that exposure to diagnostic radiography is associated with an increased risk of lung cancer. Radon is recognized as a natural environmental lung carcinogen, Group 1, found in both occupational and non-occupational settings. Furthermore, radon exposure is the second most significant risk factor for lung cancer after smoking, contributing to 14% of lung cancer cases. Moreover, radon exposure in mining, particularly among non-smoking underground mine workers, has been associated with an increased risk of lung cancer. Additionally, radon exposure leads to oxidative stress, resulting in the release of reactive oxygen species, ROS, and hydroxyl radical attack, contributing to genomic instability. Medical ionizing radiation exposure from diagnostic X-rays and radiation therapy gamma rays is linked to various cancers. Furthermore, according to the IARC report, X-rays and gamma rays are classified as Group 1 lung carcinogens. Moreover, studies indicate a significant association between radiotherapy and the development of second lung cancer with a relative risk, RR, of 1.23, 95% confidence interval between 1.07 to 1.43, among patients treated between 1961 and 2007. The respiratory tract is exposed to air pollutants daily, consequently leading to a chronic inflammatory response and oxidative damage. Moreover, exposure to harmful particles and gases such as sulfur dioxide and ozone increases the risk of lung cancer. According to the World Health Organization, WHO, approximately 250,000 deaths per year worldwide are attributed to this risk. Furthermore, a recent study uncovered a strong link between high exposure to airborne particulate matter, PM2.5, high genetic risk, and smoking, thereby highlighting the significant association with the occurrence of lung cancer. Heavy metal consists of three categories, which are cadmium, asbestos, and arsenic. Cadmium. Exposure to CD occurs through the inhalation of tobacco smoke, polluted air, the ingestion of contaminated water and food. It targets the liver, testes, lungs, and kidneys, following acute and chronic intoxication, and also stimulates tumorigenesis in prolonged exposure. CD levels in patients with advanced stages of squamous and large cell lung cancer were detected as high compared with remaining lung cancer types. Arsenic. Exposure to arsenic can occur through ingestion and inhalation in the form of soluble arsenide particulate arsenic trioxide. Long-term inhalation of arsenic can cause chronic arsenic poisoning. Arsenic can cause hyperkeratosis, skin lesions, and bladder and lung cancer. Asbestos. 125 million individuals are globally exposed to asbestos, which can lead to lung cancer, laryngeal cancer, and mesothelioma development. Next, the asbestos transmission, the exposure. Primary or secondary exposure to asbestos, which are ceiling, flooring, and water pipe. The entry of the asbestos is through inhalation or oral route. Asbestos fibers stick and embed to the peritoneum, pericardium, and pleural. The irritation of asbestos fibers causes inflammation and scarring of healthy mesothelial cells. For the cancer growth, asbestos fibers mutate the mesothelial cell over time, leading to uncontrolled tumors.